Good afternoon, everybody, and welcome to our webinar. My name is Cynthia. I am the manager for the CDAP Suite Success and Resource Center. Before we get started, I would like to do a little bit of housekeeping. The first is everybody should have received a set of handouts if you registered for the webinar as of Monday morning. You should have received a set of handouts for today. I did get a lot of bounce backs. If you did not receive your handouts, let me know. I will send them back out. We got a lot of spam filters. So if you want to add me as a safe sender, it'll ensure that you get your handouts in the future. Second thing is that everybody is on mute. We want to make sure that Jacqueline's presentation is not interrupted today by accidental phone ringings. I will be sending everybody a follow-up email in a couple of days with links to the handouts, to the video, the CEUs. Everything will come in 2 to 3 days. If you are listening as a group, please send me an email telling me who the host or the person who registered is and who is listening as part of your group, whether they're an RN or an RD, and the license number so that I can quickly turn around your CEUs or CPEs. I would also like to remind everybody about the evaluations. Please do them. It's how we know that we're doing a good or bad job, where to improve, and what you would like to hear next time. The links and the archived and all of the other materials is going to be posted on our website. It's www.cdapsuitesuccess.org. Look for archived webinars and trainings. And this is under resources, excuse me. Click on resources and then go to archived webinars and trainings, and you will see a long list of the past webinars that you can access. If you need to hide your control panel, go to View up here or the orange arrow. This will help you minimize and maximize your questions. We will be answering questions at the end of today's presentation. Please type your questions in this box right here as we are going along. It helps us get everything organized if you type in your questions as you think of them. Today's topic is cultural and psychosocial competencies relating to the care of women with gestational diabetes. Our presenter is Jacqueline Masullo. Jackie was the Regional Social Work Consultant for the Sutter region. She's worked with CDAP Suite Success Program with the regional teams, helping to update both professional and patient education materials, educating the patients and other professionals. She will be speaking on our psychosocial and cultural issues today. Jackie is currently the Women's Ambulatory Services Coordinator for Sutter Health Sacramento. And let me hand over controls.
Good afternoon, everyone. My name is Jacqueline, as Cynthia said, and I'm a licensed clinical social worker at Sutter Memorial Hospital in Sacramento, and I've worked in diabetes and pregnancy for over 10 years. This is something I feel very passionate about, and I'm very happy that you're able to be on this call. So I did ask Cynthia before we continue, or actually let's go to the first slide, is why do we need to address the psychosocial issues anyway? And just to get an understanding of where you're all coming from, I've asked Cynthia to ask a couple of questions just so I can address your specific needs from your clinics. So Cynthia, I'll turn that back over to you.
Oh, thank you, and I am really, really sorry. The question that I have up has the wrong answers. So let's do this. In general, I'm sorry, this is the wrong one. Let me see if I've got the other one. Close it. Oh no. I apologize. These are all of the old poll questions. Jacqueline, I will fix them and get back to you. Yeah.
Continue?
Yes,
okay.
Please.
So let's talk about this. working at Sutter, here in Sacramento, where I'm from, we have a multidisciplinary team consisting of a nurse, dietitian, and social worker. In the past, social workers have been accessed to address red flags with our patients, women coming in presenting with high-risk factors like domestic violence, substance abuse, depression. However, we're really trying to shift that. It's more from the traditional medical model to more of an empowerment approach, that psychosocial issues should be educated from the get-go. This helps instill a level of empowerment with our patients so they are co-providers in their self-management. We know that 95% of diabetes care is with the woman, is when she leaves. We offer the education, the tools, but she is the one who's going to be actually instilling this practice at home. So we want to make sure that she feels confident and believes, values what we're offering. So we're going to continue here. Working with my team, the nurses and dietitians also address these psychosocial issues. And it's funny, our dietitian and I have kind of a joke that they always bring up what they're not eating with me and what drug of choice they're using with their dietitian. But I think it's because we're both able to speak to these issues. Psychosocial services focuses on the relationship. We want to start with where the patient is. So when she comes in, a good question to always begin is, how are you today? What are some things that you would like to talk about today? What's important to you? It's starting with where she is, as opposed to trying to impose, I only have 30 minutes with you today. I need to make sure that you learn a meter, you learn a meal plan, and I got to get you out the door because I have somebody else behind you. We really, if she's not engaged, if we're not addressing where she's at, we're not going to be educating her, and she may leave without any of the information that we tried to fit into that time schedule. So I'm going to continue to go here. So timely psychosocial intervention is essential. It improves adjustment. If she's coming in with particular depression or anxiety, stress, she's in crisis because of the diagnosis, it's important to address it from the get-go. If there are other psychosocial issues, for example, like she's homeless, she's having arguments with her partner, her child she's got a parent-teacher conference with her child and she's not even present with you. It's really important to address where she's at, because it does improve adjustment. This will reduce or prevent mood or anxiety disorders. It improves treatment adherence. She's going to participate if we're addressing the stressors that are competing with this diabetes management. And we know that it supports metabolic stability, because we know that when one is stressed, this does elevate blood sugars, not only from a pathophysiology perspective, but when one is stressed, they may be distracted from their diabetes self-management. So as stress is managed, we are going to see better blood sugar control. So the diagnosis of diabetes is a crisis, and for some it's a sign of their mortality. It is something that is wrong. They may now be considered a high-risk pregnancy that's going to require more doctor visits, visits for non-stress tests to make sure the placenta is functioning well. We have changed the identity of this joyful pregnancy experience to something that's going to be worrisome, that if her changes that she makes, if she doesn't make those changes, there could be some potential poor outcomes. So we do want to see, how are you feeling about this diagnosis? What do you know about it? A lot of women feel guilty. It's my fault. It's the way I was eating. I should have been healthier. I made poor food choices. I shouldn't have been eating so many donuts. I needed to be in better health when I got pregnant. We really want to address these feelings and try to shift it away from her feeling guilty to, what can you do about it now? You're here, we're going to give you the tools so that, and the things that you're going to make are directly going to impact the health of your baby, which is definitely a joyous experience. We really want to emphasize that as we're talking with them during their time with us. And the final outcome will be a healthy baby, because we know research shows that that following a meal plan, checking your blood sugars consistently, keeping your stress levels down, is going to give you a healthy baby. Your chances are very, very good. So
Jackie, I'm sorry,
yes.
Jackie, I'm ready with the first two questions if you'd still like to do them.
Yes, please.
Okay, so the first question is, do you feel comfortable addressing psychosocial cultural issues with your clients? Yes, no, or not applicable? Okay, we've got 50% answered, 68%. Okay. Okay, so 85% said yes, they do feel comfortable. 10%
Excellent.
said no, and 5% said it wasn't applicable.
Okay.
So let
Thank
me
you.
pull up the next question. Okay, so our next question is, who usually addresses these issues with your clients? The social worker or a psychosocial consultant? I do, the RN or RD. No one does, or not applicable. So about 32% say a social worker or a psychosocial consultant. 59% say that they do the RN or the RD. Nobody said no one. That's good. And
Okay.
9% said it is not applicable.
Okay. So it sounds like the majority of you are handling the psychosocial issues on your own. That some of you do have a social worker available, but these are things that you're going to probably be incorporating during your education with your patients. So that does help me, because then I know who I'm speaking with. And I think, and also the first question was that your comfort level. Sounds like a vast majority of you are comfortable addressing these issues, which is wonderful, because some of these topics can be frightening and intimidating, especially if you don't have the resources available to address them. So let's use it from that perspective, is to talk to mostly to obviously I want to address everybody, but to those who don't have social workers or who are doing this on their own, is when you are looking at what influences the way a patient responds to a crisis. Certainly her past emotional or previous stressors are going to affect that. How has she dealt with it in the past? What worked? What didn't work? What are competing stressors that she's dealing with now? Past experiences. Is this the first time she's had gestational diabetes? Has she had it before? Were there good successes, good outcomes with it, or was it very difficult? Developmental level, this is something that's very important, because we're seeing gestational diabetes happen early and earlier in our patient population. We are seeing teenagers, I'm sure some of you are seeing younger patients as well, but in Sacramento we are seeing women under the age of 20 who it's important to understand where they are developmentally. Are they going to understand these concepts, or are we going to have to speak more concretely? Really, the importance of reassessing their comprehension at follow-up appointments is critical. What is their knowledge base of diabetes? And this is interesting, because I think a lot of people having access to the internet are doing a lot of more internet searching to find out more about diabetes, which may or may not actually be helpful, because it may not be correct, or we tend to post scary things on the internet, or they have a family member who's lost their foot, or is on dialysis, or is going blind from retinopathy. That we really want to make sure that they understand what gestational diabetes is, give them a context of what it is, that actually this is a pre-diabetes diagnosis, that is we're going to get you the education so that you can prevent getting type 2 diabetes down the road, where these complications can occur. Ability to access personal strengths, and sometimes you need to be pretty creative here, that you're hearing a lot of stressors being listed, and you really want to focus on what has, as again back to that first item, what has helped you with past emotional crises, what has helped you with past stressors, and really reinforce utilizing those coping skills presently. Support system. According to Dr. Aaron Beck, failure to receive adequate social support may lead to postpartum depression. Support is critical, and we have support in different ways, whether it's in a group setting, if you offer group education, from their family, from their neighbor. They may list, yes, I have my spouse, my aunts and uncles live nearby, my mother's always over. Again, tell me how you feel about this support. Is this support helpful, or is this another source of stress? And culture. We're going to talk about culture at the end of the presentation, but culture definitely can affect blood sugar control. And our dietitian seems to see a lot of challenges with this, especially when it comes to food choices, fasting, vegetarian, not being able, we see a lot of, in Sacramento, we have a large East Indian population who choose to who are vegetarians and tend to eat more carbohydrates. So this can definitely be challenging.